Muscle and bones. They have decreased strength and endurance. Their bones are very brittle and can break. Their joints are stiff and painful. A lot of them have arthritis. They may have some bone deformities. They may be hunched over. A lot of older adults have back pain, back discomfort, back problems. They have decreased range of motion. If you're going to try and dress them, they might not be able to raise their hands all the way up or get their leg up all the way. So you need to take that in consideration. And they have impaired mobility, poor balance, poor coordination. Some of the considerations: we want you to handle their joints gently. Don't rush, push, or pull them because you could fracture, break a bone, dislocate. Assist them with rising slowly. A lot of older folks will be sitting and you get them up and their blood pressure will drop and they'll get dizzy and fall. Make sure you have hands-on assist, and you'll kind of know who needs the assistant and who doesn't, and just ask. And they may need 2 people to transfer. You might have some older adults in wheelchairs or just can't make the walk, the distance, and they may need to be put into a wheelchair and transferred with 1 or 2, depending on their size and functional ability. Cardiac and respiratory, their heart is less effective, and that results in decreased oxygen, which results in they're going to tire easily. Their arteries are narrowed. When you're undressing someone or you're going to put them in, you may see some discoloration, swelling of the lower extremities. The respiratory muscles are weak, so you'll see older adults who are short of breath. They may be short of breath at rest and with exertion, or they may have oxygen. Because of the weak respiratory muscles, they have decreased strength in their coughing, so they may have more congestion. And it's real important that you take these considerations. If a person is on portable oxygen, of course we all know, keep them away from a flammable source. We want to position the older adult. We want them to be upright. That'll help with their breathing. We want to provide wheelchairs, chairs, benches, whatever we can for keep them from getting short of breath. We want to pace the activity again because of the strength, the endurance, the fatigue. And don't put any restrictive clothing or material around their lower legs. And a lot of the elderly folks will have these thick support holes that are really tight. So you want to use care and caution when you're removing them. Bowel and bladder, they have reduced bowel and bladder tone. They may have accidents. They have a decreased or delayed perception that they have to go. They have poor bowel control, and some older adults may need to wear products, diapers, adult diapers. You want to offer toileting, and again, they may need some assistance. You want to make sure you ensure their privacy and dignity. You don't want to say, I need a diaper up here. You want to provide that dignity. They may need assistance of putting on the disposable brief. And make sure that if they do have an accident that we get them cleaned up, because that'll irritate their skin and cause problems. Infections, skin breakdown. Gastrointestinal. They have a decreased thirst perception. Some may experience difficulty with chewing. Some of them have no teeth, some have few teeth, some have partials, some have dentures. And so you want to ask them what they have, because they could take them out themselves and actually be part of the decontamination process, rinsing their dentures, their partials. And you want to inform the adults to keep their mouth closed during the decontamination process, because they might choke on the water, cause some pneumonia. Now it's important to keep, like Susan said, it's important to have the caregiver go through first. And it's important for you to allow the caregiver to accompany the older adult. And regardless if it's opposite sex, they should still be able to go with that person, because it's going to be much more efficient processing these people, because they're going to know their limitations, their functional ability. They're going to be able, the older adult will trust them and do what they want.